Well, we were promised a blockbuster week from the inquiry into COVID, and that's exactly what we've got. Today's hearings bringing what felt like a swear word every second, but also reminding us of a world in crisis and the way those in power responded or failed to.
From this evening, I must give the British people a very simple instruction. You must stay at home.
I think what will probably be clear in COVID, it was the wrong crisis for this Prime Minister's skill set.
Or claims that ministers were desperate to avoid responsibility, advisers in despair and constant war behind the scenes.
You called ministers useless pigs, morons, in emails and WhatsApps to your professional colleagues. Do you think you contributed to a lack of effectiveness on the part of ministers and of the Cabinet?
No, I think I was reflecting a widespread view amongst competent people.
Now, revelations too about the Prime Minister's perceived priorities. WhatsApp messages shown in which Boris Johnson, quote, slightly rocked by some of the data on COVID fatalities, claimed hardly anyone under 60 was hospitalised, while virtually all younger sufferers survived. More, he said he didn't buy all this NHS overwhelmed stuff. Asked what that meant for his COVID policy, he gave a simple answer. He didn't want to go for a second nationwide lockdown. Now, here's what the man he was talking to made of all that.
You can forgive some of the errors in the first lockdown because things were moving at incredible speed. I think by the time we moved into this later period, I think the rump of number 10 felt that, OK, well, we've learned all these lessons from the first period of lockdown. Why are we now trying to ignore them?
In December 2020, Johnson even apparently told scientific advisers his party thought, quote, COVID is just nature's way of dealing with old people, and I'm not entirely sure I disagree with them. He made that comment on the 12th of December 2020, which was 6 days after the first person in the UK was given a COVID vaccine. The constant policy changes, the endless swerves from side to side, meaning his most senior advisers held him in open contempt.
The term you used and his Cabinet Secretary used and his Director of Communications used and other officials, no doubt, about his propensity to...
Pretty much everyone called him the trolley, yeah.
Change direction.
The trolley. Well, today's revelations have been in turn shocking, sweary, even sometimes perhaps funny, unless there is, of course, your mother, your brother, your grandparent or your friend is one of the 231,332 people who have passed away with COVID-19 on their death certificate. Then you might be thinking rather differently of all of this circus. Well, I'm joined now in the studio by The Spectator's political correspondent James Heal, Safia Ngah, who lost her father to COVID in February of 2021, and also Andrew Lansley, Lord Andrew Lansley, as well, the former Secretary of State for Health. Thank you, all three of you, for joining us. And James, I want to start with you first on the politics of what we've seen. We spoke yesterday, you and I, about the first day of exchanges. What developed today? What were your takeaways?
Well, I think really it shows that it's been a really chaotic painting of what happened in number 10, actually. And for all the kind of talk at the time, perhaps, of the way in which there's supposed to be a Rolls-Royce machine, what we now discover was that under the bonnet there was serious malfunctions in the engine of the state. I think that some of this can be painted as the kind of Boris Johnson kind of psychodrama, what was going on with the kind of Lee Kane, Dominic Cummings personal tensions. But the more fundamental questions, I think, of what was the advice being given in March 2020 at the time when there were conflicting things being said by different scientific advisors. The NHS graphs, according to Dominic Cummings today, were out of date. And really, I think for all the kind of preparation around what the NHS was meant to be preparing for this pandemic, it wasn't nearly as good as we thought it was at the time. Now,
I want to come back to you and talk a little bit more about some of the culture at number 10. But first, let's cross to Safia, who, did you watch much of this today?
I watched bits and pieces, and I've obviously read a lot of the text messages that were read out. I've seen a lot on Twitter, and I find it, to be honest, really hard to follow the inquiry. Perhaps unsurprisingly, I think that sort of chaotic culture that you spoke to is very clear in the witness statements that have been given, and I find it extremely difficult to accept that and to hear those statements when I know so many lives were at stake, including my dad's.
So sorry, Safia. And just remind us a little bit, or give the viewers an idea of what the experience during the pandemic was like for you.
So my dad had no underlying health conditions. He was 68, and over Christmas sort of just after Christmas, he contracted COVID. My family lived in central London, and obviously the numbers were really high there. He had no underlying health conditions, but within a month he passed away. He went into hospital sort of a week after contracting it. Then he was put under, I can't remember, ventilation. And we were fortunate enough, I suppose, to be able to be with him when he did pass away, but it all happened incredibly quickly and was deeply traumatic. And, you know, I can only speak to my experience and my family's experience, and this is something we'll live with forever. When you think about how many people died of COVID and how many people are dealing with the very serious consequences of what happened to their loved ones, and you see what the decision makers in government were doing and talking about with the people that they are supposed to protect, are supposed to serve, it's bizarre. It doesn't feel real.
And this obviously, it's not a very pleasant experience for you reliving that. You volunteered to come in today and speak to us and join this panel, and I appreciate it. It must be incredibly tough and emotional for you to relive these moments. Is the reason that you're doing that because you want to remind people of the reality of the situation?
Yeah, I suppose it's that. And, you know, we fought really hard for an inquiry into the pandemic, an independent inquiry. I think for me and my family, the only way that it's sort of even vaguely possible to accept my dad's death is to know that this A, won't happen again, but B, that the pandemic allows for some sort of introspection to think about the ways in which this country is run and was run and what led to so many deaths, and in the hope that, you know, we can improve our healthcare system and improve this country so that the people that are most vulnerable aren't as at risk from a pandemic or any sort of healthcare issue.
Well, pandemic preparedness was one of the big issues under focus. We're also joined in the studio by Lord Andrew Lansley. Listening into that, it's right that pandemic preparedness should be under the spotlight here, isn't it? Because what is becoming apparent from the inquiry is that they were ready for a flu, but they weren't ready for what happened.
Yeah, Rosanna, thank you for the opportunity to comment on this. May I say to Safia, I mean, you and many, many other people would be entirely right to be very angry about what was going on, because government carries with it tremendous responsibilities, and people should behave in exactly the way you described, putting the public whom they serve first, rather than, as they appear to have done, spending a great deal of time worrying about their own situations and the interaction between individuals. That's not what it's about. It's about delivering for the people they serve. But you ask a fair question. I mean, I knew from conversations that I had with some of the decision makers back in February 2020, and I was frankly somewhat amazed by it, that they said, well, we're working to your plan. And I said, well, my plan was a flu plan, and it was written in 2011. So, of course, that's asking, necessarily the inquiry should be asking a pretty serious question, which is, why was there not a plan optimised for SARS? Because in between 2011 and 2020, we had seen, particularly in Asia, major SARS-related outbreaks. Now, we wouldn't have known what COVID precisely was like, and the testing programme, of course, was, and understanding the nature of the virus you're dealing with made it, in a way, it is understandable, as I think Lee Kane was saying today, that they didn't really understand what they were dealing with for the first few weeks. But the two things you'd have expected are, first, that they would have recognised they're dealing with something other than flu, which I'm not entirely sure they did. And secondly, that they realised that that meant that time and an understanding of the virus and the testing that Public Health England was doing at the time was absolutely critical. As it happens, in this country, we were among the first countries actually to sequence the COVID virus and to understand what it was all about. The point was that time should have been used to put some of the measures to try and contain and mitigate and delay it in place, and some of them weren't, like border controls and the like.
Now, you mentioned SARS there. I often feel like a broken record talking about this because I speak about it a lot, but I was in Asia, I was in Singapore for the 2 years of the pandemic. It's often held up as a model, some people say, of what we should have done. I can say there were some things right, some things wrong in terms of the way that they locked down society. But looking at the way they were prepared based on SARS versus the way the UK dealt with things, it's disappointing as a British person because Britain led the way so much in things like the vaccine, you know, development as well. So there's certain things that Britain can do very right, James. But what is coming out in the inquiry is that, as Andrew Lansley was just saying there, people seem to be more focused on their jobs and the hierarchy and the power.
Well, I think, yeah, first of all, let's say, I think that, pretty crudely, I think that the story of Britain's government in 2020 is a lot worse story than the one in 2021. In 2021, we could talk about vaccines, etc. Later in the inquiry, we'll get to that, and this went right in the pandemic inquiry in the government at the time. But I think 2020 is definitely the worst bits. And I think listening to those two answers just there certainly was the failure to learn from the mistakes earlier in the pandemic. So the mistakes made in November and December 2020 are all the more exasperating as a result of that. But as you say, the kind of culture, the setup in Boris Johnson was very much more kind of like a feudal court whereby there's competing factions. And what was so exasperating so far, we've heard from the kind of evidence given, is that so many of the people who are critical of Boris Johnson now were appointed to him. And I think Lee Kane's evidence, for instance, this morning was all the more powerful by being someone unlike Dominic Cummings, who went public with a lot of these claims 2 years ago. Lee Kane has largely kept his counsel since leaving Downing Street 3 years ago. And so his comments all today saying that Boris Johnson was the worst person for this, was not the crisis suited for his strengths, basically reveals what we all thought at the time, which is that he was very much a cavalier figure rather than a roundhead. He didn't much enjoy being the Puritan telling us to stay at home, and that while he might have been very good with the words, often with the numbers he was perhaps less so. And that's why we see him kind of, as in Dominic Cummings' parlance, being like a shopping trolley being pushed from pillar to pillar, rather than taking the strong lead on this that might have been enable Britain to get out of 2020 much better off.
And it's certainly no secret that Boris Johnson has always wanted to be remembered well in the annals of history. Supposedly it's one of the reasons he switched from being a journalist to a politician. He probably wanted to be remembered as being a great wartime leader through the pandemic, but it's quite the opposite of what's happening out of this inquiry.
Well, certainly the first few months or so, but I think that you know, it clearly was not suited to his strengths. And I think even Boris Johnson's most ardent defenders would struggle to get him out any more of a defence other than he did the best he could at the time. But clearly his best was far from what Britain wanted or needed at the time.
Safia, how has your mood changed from during the pandemic, despite what you were dealing with in your family and with your father, but the feelings about the government? Were you ever sort of supportive of them, or did you ever think they had their act together? Are you being surprised now by the inquiry, or is it as you expected?
It's pretty much as I expected. I wasn't enamoured by the way that the government was dealing with the inquiry. You know, before my dad died, the Eat Out to Help Out scheme was enrolled, and it didn't feel like we were really taking the pandemic all that seriously. And, you know, I'm a young person. I wanted to have my life back. And after my dad died, you know, my family, as much as anyone else, possibly more, wanted to be able to move on with our lives in some sort of way. But I think the sort of callousness that is really evident in the inquiry and the way that these text messages were sort of exchanged, it all feels quite scandalous, and it doesn't feel like you're hearing about a situation where hundreds of thousands of people's lives were at stake. Yeah, I don't unfortunately find it that surprising, and that's maybe why I find it quite hard to watch and read any of it, because it almost feels kind of inevitable that so many people were going to die.
Do you have any hope about an outcome in terms of a ruling? Is there anything you'd like to see happen after this?
Yeah, I think obviously, like as a group, we'd like recommendations to be made, and we'd like to see justice. We'd like to see the people that were responsible be held responsible. I think personally, for my family and me, I sort of mentioned earlier, but the people that were the most vulnerable to COVID were the people who are the most vulnerable in our society. And I think that's something that we really need to take heed of and think about why that was, and why our healthcare system isn't able to look after the people that most need that help. You know, the people with disabilities, people from minority ethnic groups like my dad, elderly people were the most likely to die of this virus. And I think it's really, really important that we think about why they weren't represented and cared for in the way they should have been.
Thank you for that very considered answer. Lord Lansley, just finally, if we're going to learn anything from this and move forward from it, apart from pandemic preparedness, what are your hopes?
Well, pandemic preparedness is the most important thing to learn, because quite clearly we were not as prepared as we should have been. And when you look at the risk register, when government looks at what is likely to happen in the future and what is likely to have the biggest impact on us, a pandemic is amongst the most likely and most serious events. And the fact that we've had one pandemic doesn't mean we won't get another. and the virus may well be different, just as this time it was different from the anticipated H5N1 flu virus, which we anticipated would be the next pandemic. So the next one might be H5N1 and it might be flu. But the point is there are some things we can really learn. Some is about the availability of intensive care facilities in hospitals, which were increasing, but nothing like the rate we wanted them to be. The ability to have surge capacity in the NHS. The ability to do not only diagnostic testing on patients who have the disease, but the ability to test populations, the ability to decide whether we should lock down or not. The flu plan didn't say we should lock down schools, but they just said, well, let's lock down schools. Well, to be perfectly honest, I think there was a big debate that should have been had at that time, because the virus might have been transmitting through the population in schools, but it wasn't actually affecting young people quite in the way that it was affecting older people. So there's a lot of those kind of issues that I really hope the inquiry enables us to not only to understand what went wrong, but actually to put in place the things that are needed potentially in the future.
Lord Lansley, Safia Ngah, James Hill, thank you very much.